First of all, I wish to thank you for inviting me. I think it's a nice chance to discuss briefly with you. And I believe that, as Professor Ciardiello already pointed out, how can you personalize anything if you don't know the disease, if you don't know the subtleties of the disease? So, first of all, and I think Professor De Lorenzo has already mentioned it, well, molecular pathology comes after pathology. So first of all, and this is, is something usually taken for granted, that diagnoses are accurate. So you need to give a name to the disease, and the pathologist is the professional who gives the name to the disease. And as you know, nobody better than you know how broad is the variety of cancers. And when we say sarcoma, carcinoma, lymphoma, we actually say nothing, because we have hundreds and hundreds of diseases that need to be recognized. And the reason for recognizing them is exactly personalization, because if you don't know what you're treating, there's no way even to go any deeper. Well, certainly genomics, but I would say also epigenomics, which is a very, very bad word to make you understanding that the biology of cancer is very complex. And we admittedly have been very naive in the past. We always thought that all the problems were related on how the genes get crazy in the cancer cells. But actually, is even more than that, is how genes get regulating their transcription, which is equally important. Is the flow of information that comes from the gene to the proteins, which is equally important to the aberration of the genome. And since Kerry Mullis in the 80s, the Nobel Prize, which is now basically out of medicine, discovered the new tools in order to investigate the genome, the technologies has changed dramatically. So now we have better tools. Professor Ciardiello has been mentioning deep sequencing, next generation sequencing. So we can now know much more. And any of you has under his eyes all the examples of how we can now tell that lung cancer, for example, is not anymore a single disease, but lung cancer can be stratified into molecular variants of lung cancer. And having that information may lead to specific treatment. So an ALK mutated lung cancer patient is not like any other one. This is what genetics brings into pathology. So to do that, you need to apply the technology, and the relationship between molecular genetics, molecular pathology, and the treatment has grown very, very strong now.
What do European patients really need to know and learn and understand regarding their own role in advancing molecular pathology, and especially, as you said, considering the importance that tissue analysis plays in potentially tailoring therapies?
One of the first questions would be also, who is the owner of the tissue? You are the owner of the tissue. So what can we do? Why we need the tissue? Because all the information we can provide are sitting in the tissue, in the biopsy, in the samples. I know sometimes it's difficult to get them. This has been mentioned already. But we desperately need, if we do not analyze those, there's no way we can provide you any information. And I just gave you some examples. So what can you do? We are facing obstacles currently because the whole issue has been regulated under the umbrella of privacy, which is, of course, important. Defending your rights as human beings is a key issue. But also, we should try to focus a little bit on the necessity to use that tissue. Of course, we need to have rules, but the approach we're currently facing, which is basically preventing clinical research and translational research under the excuse of protecting your privacy as a human beings is an increasing obstacle. We, as researchers, as molecular geneticists, as pathologists, we are really looking into the future in which is becoming increasingly difficult to try to answer to the basic question of cancer genomics, right, because it is increasingly difficult to use the tissue for these purposes. So you may help us in that.
With the new therapeutic approach and the use of target therapy, the molecular testing is getting a very relevant role. And in this case, it's very important for us, for example, as advocacy, to educate patients in these issues. So patients have to receive a very clear, very easy and transparent information about that. Because it should be, the doctor must explain him the reason because he has to perform this molecular testing. He has to explain that target therapy is a new treatment option and that is a cutting edge of the research and clinical application. So it's necessary to perform this molecular testing in order to define if maybe there is some tumor characteristic which can be targeted with one of these therapies in order to determine if maybe he is the right candidate to receive this target therapy and maybe to benefit of it. But on the other side, I really believe that the communication between clinicians and patients must be really accurate and educated, in the meaning that the patient has to know exactly the situation. He can be also important to empower him in the treatment decision, but it's important that he knows that not every patient could be eligible for receiving a target therapy, because this is important to avoid that people, for example, in Italy, they move from one center to another looking for the place where they can receive something that really they cannot because there are not the right candidates. So I think it should be really a honest communication between patient and clinician.